So estrogen dominance isn't an official medical diagnosis. And one of the reasons for that is because of the medical blind spot around progesterone. However, the medical profession does recognize that there are conditions affected negatively by estrogen. So they will acknowledge that things like endometriosis are exacerbated by estrogen. The symptoms described, the contraceptive pill or HRT is often prescribed. And this is actually where one of the problems is because you're often taking someone who's estrogen dominant and then piling more estrogen into the body. It's an incredibly limited perspective. If a woman has had a hysterectomy, I don't actually even want to say this because it's quite generalized. It's what I'm about to say is basically a postcode lottery. It can be common if a woman has had a hysterectomy for only estrogen to be prescribed. However, depending on how well her doctor is trained, some doctors understand that we still need this seesaw to be balanced because they understand that progesterone isn't just about thickening the womb lining. So there's also different hormone therapies for estrogen receptor cancers. So aromatase inhibitors, aromatase actually stimulates the body to make estrogen. So the inhibitors prevent fat cells from making estrogen. We have gonadotrophin releasing hormone agonists, which stop the ovaries from releasing estrogen. Selective estrogen receptor modulators, such as tamoxifen, which block estrogen from connecting with cells. I mean, I am very aware that tamoxifen has saved millions of lives. I know from close personal friends going through and lots of clients going through tamoxifen therapy that it can feel absolutely horrific. So it's a really challenging time, and it can be for 10 years that you're on tamoxifen. Luteinizing hormone agonists or LH blockers, they stop the ovaries from producing estrogen, and surgery to stop the ovaries from working, which seems quite a lot, really.
I think what's important here is that we as coaches often see women who are on the pill, on HRT, on estrogen only HRT, are on hormone therapy for an estrogen receptor cancer. And what we can do if we are supporting someone who is in the situation is, because of the way that we look at the body, that estrogen is just one part that we work with. We understand that we're not able to do anything with that part, but there is so much that we can do to support the body around that estrogen issue. So this is where we're looking at blood sugars, gut health, immune health, coaching, good nutrition, making sure that the right micronutrients and macronutrients are going in, because if they're on this medication, then that is going to be an issue that we got to work around. What I want to say.
Yeah, this is absolutely not something that we recommend people obviously do something different. We would never recommend that. We support people with the choices that they have made in line with the medical recommendations. Some people actually, I have had situations where some people have refused things like tamoxifen therapy because it made them feel so unwell. And in that case, they have already told their oncologist that's something that they are talking to them about. And often they then come and go, what can I do naturally to remove the estrogen? And then we can work with them. I still always get sign off from their oncologist for any supplements we're using. And there is no guarantee. There is no guarantee. So I just want to be really, really clear about how we work with people who are presenting with cancer. We don't work with the cancer.
We work with the person.
We work with the people presenting with cancer.